Thanks a lot, Donna. That's right. We are fortunate to have in our area now Dr. Ceydeli from Hawaii and New York and other places. But what's interesting about you being here now is you're not just coming in as a new doctor to our area. You have some new procedures as well, Dr. Ceydeli, and this is very exciting for a lot of folks. Everybody's heard about facelift before. You have something. It's an alternative to a facelift. Is it something that people that might be considering a facelift should consider this first?
That's right. It's called MAG-5 that I adopted this procedure from my mentor, Dr. Flowers in Hawaii.
Okay.
And it's a complete upper and mid-face rejuvenation. Unlike traditional facelift procedures, it addresses more around the eye region, which we see the effects of aging the most prominent. Traditional facelift procedures usually address the lower face and neck area and can't do anything to the eye region, and this procedure has like 5 interrelated components done at the same time, and it comes, in my opinion, before facelift.
So you learned this procedure from the originator of it in Hawaii?
Dr. Flowers is one of the most well-known plastic surgeons, I would say, in the country, and he's my mentor. I'm pretty proud to be trained by him.
How many other people in the country offer this procedure?
Well, as far as I know, he does it in Hawaii, and I have the legacy
here
to do it here. So we are the 2 people so far, I would say.
So wow, we're pretty fortunate to have you here then. Thank you for coming to our area and providing this. If someone's interested in doing this, of course they need to consult first. Is there a certain person that has a better chance of this working for them than others?
I think this procedure is also unique because traditional facelift procedures usually indicated after age 55 when you have a relaxed skin on the face. Unlike those, this procedure actually is ideal between ages 35 to 55, and still after 55 it's a very good procedure because we don't age overnight. Aging is a gradual process. So what happens between 35 to 55? 20 years. So this is a very good procedure to address those years as well.
What about, is there any difference in the recovery time compared to like a facelift?
No, it's not one of those lunchtime facelifts. It's a real procedure, and it depends on the patient, but usually I would say 2 to 3 weeks will be okay for recovery period.
And so once again, this would be something that they would need to consult with you about, and then you can help them make a decision if that's the right thing for them.
Sure. We can sometimes add a few other small procedures. It's, as I said, it's 5 interrelated procedures done at the same time on the face, and not everybody is a candidate, but I would say it doesn't discriminate against age, sex, or race. So everyone.
Okay. Now I understand that there's going to be a free seminar November 29th at the Panama Country Club. It'll be at 5:30 in the evening. 747-6541 is the number to call if you want to find out more information about that. That's 747-6541. And Dr. Ceydeli, you have a website, correct, that people can get more information on?
It's baymedicalplasticsurgery.com.
Okay, baymedicalplasticsurgery.com. His office number is 747-2010, correct?
Yes.
Pretty good, huh? Can you stick around? Can we talk a little bit more about this and maybe something else, other exciting things? So that's really pretty unique for our area. We thank you so much.
Thanks for having me.
Still to come. Welcome back to News Channel 7 today, Monday morning. And we have, a little bit earlier in the show, we introduced a new doctor at Bay Medical Center, Dr. Ceydeli. Dr. Ceydeli, thanks so much for coming out. Now, you told us a little bit about an alternative procedure to the facelift called the MAG-5, and you learned this from the actual originator of this procedure in Hawaii, and you are then one of the only other people in the country to offer this. It's pretty amazing. It's really pretty neat that we have you here, and glad that you are. Let's talk a little bit about the procedure briefly, and why is it called the MAG-5? Obviously, there's something in the name.
I didn't name it, but MAG stands for magnificent because the results are really amazing. And as I said, it has 5 interrelated components, and it's not a pull, but it's a lift procedure. So, as I said, it addresses the eye region, and it specifically lifts the brow, and then it removes the corrugator muscle in between the eyebrows. That's the second component. And the third component, actually third and fourth component, addresses the lower eyelid. It removes the excess skin and fat from the lower eyelid. And if we do that, and if we don't support the supporting structures of the lower eyelid, the almond shape, beautiful eye shape becomes round. So to prevent that, and we also support the lateral canthal ligament and the other supporting structures to the bone, which gives the support to the eyelid as well. And the fifth component is just elevating the droopy mid-cheek fat pad back to its location.
So it is a lot different than a facelift, which is pretty much incisions and pulling back. To really sort of capsulize it.
Oh yeah, it's
different
completely different than facelift, because facelift, the incisions are usually around the ear and it goes behind the ear as well, and with that pulling the excess skin, it corrects the neck deformities and maybe jowling and lower face, but it doesn't do anything with this pull around the eye area. So that's why sometimes, maybe most of the times, the patients are misdiagnosed and they think that the facelift may be the problem. That's why people end up with this operated pulled look. So this is the procedure to prevent that and to give a more natural, youthful look. It's more like a restoration, not a transformation.
Okay, and so then obviously someone that would or would not be a candidate for this technique would need to consult with you about that.
Sure. I mean, everybody's different. That's the, I would say, beauty of plastic surgery, and I like to sit at every patient and we go over things, and this is not the only thing, and this is not the only solution for everything. And again, I don't want to give the idea that I don't do facelifts. When the patient needs a facelift, still it's a very good procedure, but MAG-5 should come before that, rejuvenate the upper and mid face first, and if there's still some problem, then facelift can come afterwards.
Okay, if folks want more information, you are at Bay Medical Center, and your office number, Dr. Ceydeli, what's
I'm on the 3rd floor in Bay Medical Center, and 747-2010.
Okay, 747-2010. You have a website as well that people can get the information?
BayMedicalPlasticSurgery.com.
Okay, BayMedicalPlasticSurgery.com. That's easy enough to remember. Doctor, thank you so much for visiting us. This is really pretty exciting, and one of the few people, maybe one of two in the whole country, and we have you right here at Bay Medical, so we're glad to have you in our area. Thanks for coming out this morning as well.